Good morning.
Morning. Thank you.
Be happy to go first. Thank you. And this has been a very excellent meeting for all of us. I think especially the Science Day was wonderful, and it's good to be able to hear the public comments as well as to get the input from CFSAC in the direction that they feel that CDC should be moving and get suggestions on our plans for the future. I wanted to let you know that there's been a lot of changes at CDC during the interim during this past year that has really been rather incredible. As you know, the Center for Disease Control has a new director now, Dr. Thomas Frieden. He came in with fresh ideas, one of which was to reorganize the entire Center for Disease Control and Prevention, which he did in a very short period of time. We had just finished, as you all know, we had just finished a reorganization that took probably 4 years to accomplish. And Dr. Frieden came and wanted to make a number of changes, which he did. And some of it did affect our CFS program in several ways. Primarily, our host national center was actually merged. Our current national center is a conglomeration of what had been two national centers. When at the last meeting, I was, I believe, at the National Center for Zoonotic and Vector-Borne Infectious Diseases, and that has been changed and merged with another center, and now we are the National Center for Emerging and Zoonotic Infectious Diseases. Chronic fatigue syndrome remains in that group, but during this process, it was very unsure where the group would go. It was unsure whether that group would be split or not, and so they were in a very precarious situation for quite some time. In addition to that, their building that they were housed in has been bulldozed and no longer exists, and they had to move into a completely new building, so they had to disassemble and reassemble during this time, but in fact, they did keep up quite a bit of their work. Right in the middle of receiving the results from 3 major studies, they lost their primary biostatistician, they lost their primary epidemiologist, they lost their branch chief, and has been under the leadership of Dr. Elizabeth Unger, who is a pathologist and has been with that group for quite some time, and she has provided stellar leadership to this group and will continue to do so until the new branch chief has been selected. Now, the status of the new chief of this branch, which is the chronic viral disease branch, I can give you a little bit of update on what's going on there. The application process has been completed, and we do not know how many people applied or who applied. That information is not available to the program until what's called a certificate, until the certificate has been submitted. At this point, there is a scientific review panel that is reviewing those applicants that have come into the Center for Disease Control. This scientific review panel will gauge the skill sets and the experience of those applications and will provide to the division a list of and I really don't know the answer to this, of 3 or 5 prioritized individuals who meet the scientific and experience criteria that's in that application. I'm sorry, that's in the application. At that point, the interviews will be conducted and a decision will be made. I can't even give you a date, but I would think it's going to be within several weeks, as soon as possible. That's what we'd like to say, because there is no date that's actually put on any of these steps, because so many of those steps we have absolutely no control over. whether or not we can even arrange interviews with some of our candidates. But that process is ongoing and will soon be completed. So Dr. Unger, as the acting branch chief, her charge was to keep this group active and viable and moving forward, and she has done that. But we did not want to engage a lot of entirely new activities and programs in the absence of a new leader who is about to step in. So that's where we are with that process. So I will keep the group informed as this moves forward, and certainly Chris will be informed of how that moves forward. We have a new website release, which was, I think, released in July of this year. The content was updated and made 508 compliant, and it includes the toolkit and CME, and the print format is available in both English and Spanish at this point for public health officials, state, city, and local public health officials. The group has just recently clarified the wording on disability, and what we have heard at this meeting will further allow us to finish that clarification and to take out any ambiguities and things that should not be in there. In the process, they have also reviewed the ICD-9 codes and the ICD-10 codes for chronic fatigue syndrome. The group has had 8 publications in 2010. There's new plans for a new CME course that's underway, and all of this is in the throes of this upheaval that's been going on. So Dr. Unger and her group has just been exceptional in this. There are 3 major studies that have been completed, and they're in the process of being, the data is in the process of being reviewed at this point. One is the Registry of Unexplained Fatiguing Illnesses and Chronic Fatigue Syndrome, which was a pilot study. As you recall, there were 141 patients that were referred in this study. 88 of those patients were referred from 42 different healthcare providers, and 53 of those patients were self-referred. 104 patients were seen in the clinic, and right now the data is being cleaned. That data review is underway, and final case determinations are being made right now as we speak. The second was the follow-up study of chronic fatigue syndrome and chronic unwellness in Georgia. The data has been received, and that data cleaning is actually complete. It has been done. The analysis is in process, and they are going to take this data and take a look at the impact of using the 1994 case definition versus the content validity of the different instruments that had been added to that, and compare those two. And that's going to inform, hopefully, that's going to be very informative for what we are still planning to have a case definition consensus meeting of some type soon. We had said earlier in the 5-year plan that we would actually have liked to have done that last summer, but we didn't know then about the upheaval that was about to occur, the buildings being torn down and all that stuff, but it's still in the process and that's still in the plan. The third major study was the pathophysiologic mechanisms of chronic fatigue syndrome. This was the neuroimaging, the neuroendocrinology, and the genomic studies, and that data was just received in June of this year. The data cleaning by the staff is almost complete. The cytokine assays and the SNPs are pending, and the analytical plans are being developed for analyzing that data, and that's going to be certainly available also. Now, one of the things that's been discussed from this group and also from our colleagues, our science colleagues, is the making our data available to other groups. And until recently, there really has not been a good mechanism to do that, particularly with the IRB restrictions and everything that have been on the data. But now a research data center has been formed at the Center for Disease Control, and that will be the mechanism through which our data sets will be made available to anyone who would like to work with those data sets. The first one to go up will be the Wichita, the clinical data from the Wichita study. That's going to be available this year. I think next year the Georgia surveillance baseline data will be available, and that will be placed into the research data center that is available, and the request then for the utilization of that data would go to the research data center and not to the program itself, not to the chronic fatigue offices. That's the purpose of that data center, and they will work then, the data center people will work directly with those who categorize samples to that retrovirology group, and subsets of those samples have been provided to the Food and Drug Administration for their studies. And I believe at this point we would very much like to see a standardized test method that has been agreed upon by consensus, by everyone working in here, have a standardized method before we do a lot more testing with the XMRV, so that we're all speaking the same language, so to speak, and doing the test the same way, using the same procedures. But that is, again, being conducted by the retrovirology group at the Center for Disease Control. We've been working with the blood, organ, and other tissue safety, called the BOOT, tissue safety groups, regarding XMRV and the blood supply, and looking to investigate the prevalence of XMRV in blood donors in the United States. So it has been a very interesting time for this group. I think they have done an incredible job of moving forward, even in the midst of some of these temporary problems. But we do want to make our program accessible. We do want to continue listening to CFSAC and our other groups. We would like to make those changes that are acceptable and can be done within the mission of our program. And we will continue to listen to the group and express our interest in hearing from the group of what your suggestions are.